Hi there, Dr. Frank Johnson from Sports Medicine Ultrasound, here to demonstrate a medial epicondyle tenotomy. So how do we do this? So first thing is, again, remember, you have to put the medial epicondyle in the center of the screen. Now, the reason for that is if you put the medial epicondyle over on the far side of the screen, you've got too far to travel with the needle. So we'll put the medial epicondyle in the center of the screen. So what do we see here? So we see a darker area in the superficial aspect of the screen, which is consistent with tendinosis.
So there's that area of tendinosis. This is the whole common flexor tendon. This is the underlying bone, and then the remainder of the screen is muscle.
Now on this Clarius, I can actually zoom in, so I'll take advantage of that really cool feature where I can do sort of a multi-gesture zoom. I want you to make sure that you've got your probe aligned in line with the center of the forearm. So the way we do that is we point the distal end of the probe towards the third finger. If you point it towards the fifth finger, there's a chance that you might injure the ulnar nerve. The needle needs to come in exceptionally flat. And so again, this is a 25. I'm just going to put a little bit of anesthetic in the tissue here. Do you feel like I'm on it?
Yep.
Okay.
Absolutely.
So again, a touch more anesthetic. All right.
Yeah, that's it right there.
So that's about 1 milliliter of anesthetic. Now, the great news is during this procedure, I haven't noticed any tears opening up. Sometimes I'll see that. So now the anesthetic's in there. I'm just going to I'll pass through about 20 times. 1, 2. Now I've kind of got that central portion, so I am going to change the angle just a touch and try to get a slightly different part of the tendon. She's tolerating it really well because of the anesthetic. So there's about 10 passes there. And now I'll come up to the more proximal part of the tendon, or the more that away part of the tendon. Now, I didn't demonstrate this earlier, just because I knew I was safe. However, if anyone says, well, how do I know where the ulnar nerve is? Well, we know if we just come more posteriorly around the corner, we'll see the ulnar nerve sitting right back here. So again, to put that in context, we were treating the tissue on this side of the mountain, and the ulnar nerve is safely back here on this side of the mountain. If you were to ever see this black circle sitting on top of the mountain would be down here on the screen because this thing's sitting on top of it. So when you see the medial epicondyle immediately subcutaneous, when you see the medial epicondyle immediately subcutaneous, you know you don't have an ulnar nerve between the skin and the medial epicondyle. Okay, so that's how I do it.